Fellow Bahamians and residents, good afternoon. We are continuing to make progress in containing the spread of the COVID-19 virus. Because we acted quickly and decisively as a country and used a broad range of measures, we have been able to limit the spread of the deadly virus. To date, there remain 96 confirmed cases of COVID-19 in the Bahamas. This includes 74 in New Providence, 8 in Grand Bahama, 13 in Bimini, and 1 in Cat Key. The Ministry of Health confirmed no additional cases of COVID-19 earlier today. And in fact, this had continued for the past 4 days, where we've seen no evidence of COVID-positive individuals. The number of recovered cases is at 42. Active cases remain at 43. There are 7 hospitalized cases. The number of COVID-19 related deaths remain at 11. 1,814 tests have been completed. But we must continue to remain vigilant in order to secure our progress and to limit community spread. As a small country, we cannot allow our health system to be overwhelmed. We must continue to practice physical distancing, wearing face masks, and washing our hands often and thoroughly. We must also continue aggressive contact tracing, quarantines, and various curfew and lockdown methods. Fellow residents and Bahamians, as we continue to make progress, we will act on the advice of the health officials on the phased and gradual reopening of the various islands and certain areas of our economy, as well as a new normal for daily life that will be with us for some time. We must abide by regional and global health protocols as we reopen our economy and society. I again note, if advised by health officials, we will return to certain phases or reimpose certain restrictions in order to limit any community spread. I fully understand the anxiety and frustration of many Bahamians and residents to reopen our economy. But we must act with prudence, and we must act with good judgment. We have to balance the health, economic, and social needs of citizens and residents. As you know, we are still in Phase 1B of the National Reopening Plan, but we have started to introduce components of Phase 2 as the country fully transitions into the second phase of the plan. I am pleased to announce this evening that Cat Island, Long Island, Abaco, and Andros will now be able to resume commercial activity effective tomorrow, Monday, May 18th. Let me emphasize to all family islands that are able to resume commercial activity that weekday curfews and weekend lockdown measures still remain in place, as do physical distancing measures and the requirements to wear facial masks. My fellow Bahamians and residents, We are all eager to see our economy open up fully, to travel for Bahamians, and to welcome visitors back to our shores. The government is well advanced in our planning for the beginning of the reopening of our tourism sector and to allow for travel in and out of our Bahamas. Our resorts, our airports, and our seaports are finalizing the health and safety protocols that will be necessary for us to provide for a reopening. Taking into account what is being done within the region and around the world, these extensive guidelines will be designed to provide for reasonable assurance that travel and leisure are generally safe. Any such reopening to commercial scale traffic will also be dependent on the ongoing stabilization of the COVID-19 outbreak in the Bahamas. It will only be applied to those islands where the outbreak has been contained. As of now, we are looking at a possible opening date for commercial travel on or before July 1st of this year. These dates may change depending on the circumstances. I want to repeat, however, that this date is not final. It will be adjusted if we see a deterioration in the COVID-19 infection trends, or if we determine that the protocols and procedures are not in place sufficiently to warrant this opening. Our opening will depend on your cooperation. Our life commencing the new normal will depend on your cooperation. The success of our economy will depend on your cooperation. I wish to note that construction companies in New Providence and Grand Bahama may now operate on Saturdays from 7 a.m. to 1 p.m. To facilitate hurricane preparedness, home and hardware stores will now be allowed to operate in-store hours on Monday, 8 a.m. to 8 p.m. This is in addition to the Wednesday and Friday in-store hours that home and hardware stores are currently allowed to operate. The operating hours also apply to manufacturers of hurricane-proof windows and other hurricane-related products. Curbside and delivery services may continue as previously outlined in Phase 1B. Pharmacies may now operate from 9 a.m. to 5 p.m. Monday to Friday for general public, and Saturday, 9 a.m. to 5 p.m. for essential workers only. Also, exercise measures have been further relaxed during the weekend lockdowns. Exercise may now take place on Saturday and Sunday from 5 a.m. to 8 a.m. in one's immediate neighborhood. On those family islands allowed to resume commercial activity, residents will be allowed to catch crabs for themselves and for sale during the evenings of weekdays, curfew, and weekend lockdowns. As a reminder, those islands include Cat Island, Long Island, Abaco, Andros, Meguana, Inagua, Crooked Island, Acklins and Long Key, Rum Key, and Ragged Island. My fellow Bahamians and residents, the government is about to begin a gradual reopening of inter-island travel. The Ministry of Health has developed a policy and protocol for the approval and monitoring of individuals traveling to islands that have resumed normal commercial activity. This policy and protocol will require individuals to register with the Ministry of Health by emailing COVID-19 at bahamas.gov.bs or calling 511. Individuals must also submit to an evaluation by a Ministry of Health authorized physician in the public or private sector. I am pleased to announce tonight that almost every doctor in the private sector has made a commitment to come on board. This evaluation will include a risk assessment via a questionnaire to determine the individual's level of risk for COVID-19 infection, plus or minus a physical exam to determine the presence of any symptoms consistent with COVID-19. If deemed low risk and the physical exam does not reveal any symptoms, it is expected that the person will be issued a COVID-19 travel authorization card that will allow individuals to travel to the family island. If the individual is deemed a higher risk or has symptoms that may be consistent with COVID-19, the individual will be referred for testing to definitively determine their COVID-19 status. However, the healthcare provider may still decide that a person who is low risk may need to be tested for COVID-19. Individuals traveling on behalf of their workplace will be subjected to similar requirements. To facilitate these arrangements, the Ministry of Health is collaborating closely with the Civil Aviation Authority. Policies and procedures have been developed to enhance communication between the two organizations for decisions regarding who can travel and where they can travel in Family Islands or Grand Bahama. In the first phase of this inter-island travel, residents of cleared Family Islands who are trapped in New Providence or Grand Bahama may travel back home after going through the process outlined. That is, a COVID travel card. Individuals may start applying beginning this Wednesday, May 20th. Once cleared for travel, each traveler must present a COVID-19 travel authorization card to the relevant ticket agent. The card grants approval from the Ministry of Health for inter-island travel, and each person must also present a government-issued ID card. Residents of declared Family Islands may travel between those islands by plane or boat. Allow me to repeat. Residents in the enlisted islands that I've mentioned earlier may travel between those islands without receiving a COVID card by plane or boat. For example, a resident of Long Island may travel to Cat Island, or any other island included on the list. These residents may travel without the COVID-19 travel authorization card. Those on the family islands cleared for commercial activity may also travel to New Providence and Grand Bahama. But in order to return to their respective islands, they must complete the procedures and processes outlined earlier. My fellow Bahamians and residents, there are a large number of pleasure crafts that are being anchored offshore in Bahamian waters for well beyond 14 days. These boaters will be allowed to come onshore to conduct routine businesses while practicing physical distancing protocol. The repatriation of Bahamians from overseas will resume this week. The system had been streamlined in order to avoid what happened during the last exercise when a passenger who had a positive COVID-19 test result on overseas was allowed to aboard a return flight home. Subsequent testing by the Ministry of Health following the passenger's arrival has shown this individual is now COVID-19 negative. 2 repatriation exercises are scheduled for this coming week from Fort Lauderdale into New Providence. There will be a flight this Thursday, May 21st, and one on Saturday, May 23rd. A flight to Grand Bahama will be accommodated if necessary. Those who are seeking to return home through this repatriation exercise and who meet the required protocols, including a COVID-19 negative test, may book directly through Bahamas Air. Those who already have a return ticket on Bahamas Air should call the airline's ticket office between 9 a.m. and 5 p.m. beginning Monday, tomorrow. Passengers will be required to present the COVID-19 negative test results to a Bahamas Air agent before being allowed to board the aircraft. A representative of the council will be present who will validate the COVID test result. My fellow Bahamians and residents, I wish to remind the residents of Bimini that a complete lockdown will take effect beginning tomorrow, Monday, May 18th at 9 p.m. until Saturday, May 30th at midnight. As I noted on Thursday past, this lockdown is being implemented to slow and control the community spread of the COVID-19 virus in these areas. I want to reassure residents of Bimini that there will be sufficient food and supplies on the island during the lockdown period. Groceries and supplies arrived in Bimini over the weekend by boat to restock food stores in advance of the lockdown. The Department of Social Services distributed 600 food vouchers on Friday past to ensure residents in need had the necessary resources to purchase food before Monday. The government's National Food Distribution Task Force has also coordinated the delivery of 100 food packages through the Bahamas Feeding Network to Bimini. Additional food packages will be delivered before the end of the lockdown. During the lockdown period, a team of 12 volunteers will assist the island administrator with checking in and assessing residents in need of assistance. This group will also help to manage the food pantry on the island. The Royal Bahamas Police Force has agreed to provide escort service for the administrator and her team as needed. Boats carrying foods and supplies will also be allowed to call on Bimini during the lockdown period to ensure food stores are restocked after the lockdown ends. I had communicated this morning with the island's administrator, Ms. Pinder, who has assured me that the island is doing well and all residents and visitors are helping each other, ensuring that each has sufficient food and water to last during this lockdown. The Member of Parliament for Bimini has also been in constant communication with the residents there, and she too has assured me that the island is coping well. So as Prime Minister of this country, I am extremely proud of the cooperation and the discipline being demonstrated in Bimini during this weekend. However, I must say that I am extremely disappointed with the behavior of those in South Eleuthera who had engaged in a car motorcade on Friday. My fellow Bahamians and residents, this pandemic has claimed the lives of more than 300,000 people around the world. The scenes from around the world are heartbreaking. Our countries have faced daily death tolls near 1,000. Many countries face such death tolls. And thank God, the Bahamas and other nations in the Caribbean has acted swiftly and aggressively and have minimized the impact and has not overwhelmed our medical facilities. This pandemic has resulted in the worst economic downturn since the era of the Great Depression. And thankfully, due to the wise counsel of our public health team, the hard work of our essential workers, and the compliance of the majority of Bahamians, we had a better health outcome than many countries during this crisis. Just as we summoned the nation's health professionals to comfort this disease, just as we summoned the nation's health professionals to confront this disease, we are summoning other citizens and residents of experts and goodwill to address the many difficult economic and social consequences of COVID-19. We must remain united in purpose. This is not the time for division. This is a time for solidarity and kindness, especially those in greatest need. Let us be a community of compassion and do what we can to help others. I thank all of you who have complied with the various emergency orders and public health advice. Through the challenges before us, many are making plans to get through this together. Every day, along with my colleagues, we dedicate ourselves to developing solutions and policies to the challenges ahead. I deeply appreciate the advice and counsel of many of you. Let us continue to pray for each other. May God continue to bless our Commonwealth and all of those who continue to offer their dedication and devotion to our Bahamas. I thank you and Good evening.